And within this access center, this is where folks' initial eligibility is identified. So we check for everything like those things. Are you Medicaid eligible? Are you a Wayne County resident? Are you SED or SMI? In order to get you an appointment where you get an assessment. So it's kind of like the first blush. So this is how folks come into our system. And if you recall how our system is actually organized, you come through the Access Center and then you're assigned to an MCPN based on that disability designation and or provider. And that also depends on choice. So say you call the Access Center, you're eligible for services, and you say, well, I want my services at the Guidance Center. Well, then you will be assigned to CareLink MCPN because the Guidance Center is in their provider network. Or say, I want CareLink, because you heard of CareLink, your friends in CareLink, you think CareLink is where you want to go, you'll be assigned to CareLink. And then you may say, that person may say, well, which provider do you want? And you may not know have any idea of the whole provider network, and so you'll be given some choices. Well, you know that the Guidance Center's in your community. Do you want to go there? Not far away from you, you can go to Starfish. And then that person gets to choose that way. So there's always choice in this process. So again, they screen for eligibility. And it's a clinical screening. It's done telephonically. For some, it's face-to-face. For some of our clients, particularly, for example, maybe our most vulnerable, a good example are babies, 0 to 3-year-olds, 0 to 6-year-olds actually. We need to do a face-to-face for those. So the Access Center would assign them to one of our providers who have the credentials to do an infant mental health assessment, and that will take place in the provider network where we would do not like a telephonic screening and assessment, but a psychosocial assessment that's geared towards a 0 to 6-year-old. Other than that, most of the work is done telephonically. And it's set up so that if you call, for example, the Guidance Center, just using the Guidance Center as an example because that's where we are. Say you call the Guidance Center and the guidance, and you're a particular age, say you're over 6. So clearly you have to go through the Access Center to get your telephonic kind of screening. And there's a number of screening tools. You had asked about more screening tools. There's, at the Access Center we use, and I don't know what the acronym stands for, but I'm sure you could Google it, because that's what we do nowadays when we don't know stuff. CalLocus, CALOCUS, that's the child version, and the locus, LOCUS. These are the tools that are used, and they're done telephonically at the Access Center. So how it works is you call the Guidance Center, you call the Guidance Center wanting service. The Guidance Center will actually transfer you to the Access Center. The Access Center staff will actually do the telephonic screening and then assign you an appointment back to the Guidance Center if you're actually eligible. So ideally, you never know that you move from place to place, that the Access Center is actually doing the screening. All you know is you call it the Guidance Center. The Guidance Center does what is referred to as a warm transfer. You're still on the phone, transfer you. They do their assessment. CalLocus, if you're a child, or Locus, determine eligibility, and then actually schedule an appointment for you at the Guidance Center because there's the technology available to do that. This is the number to the Access Center. MCPNs, we talked about MCPNs, keeping in mind that they are, this is a long definition of MCPNs, but they're a network of providers. So each MCPN is an administrative organization that has a network of providers. Of those, only one is a service provider as well as a ASO, and that's community living services. They also provide services, but most of them are just administrative service organizations where they have subcontracts with other community mental health service providers to actually provide the services. Again, I mentioned which ones are which. Gateway and CareLink serve those who are adult with mental illness and children with SED. And then we have the 3 MCPNs that serve those who have a developmental disability, Consumer Link, Community Living Services, and Synergy Partners. And again, they can serve anybody across the county, but typically their provider networks are within a particular area of the county, I'm sorry. Remember I talked to you about those specialty supports and that continuum of services? Well, this is a nice comprehensive list. Now, remember I told you that CMHSPs are required to have a comprehensive array of services that will meet the needs of those who are the most severe with the most complex needs. And this is just an example of some of those services. So instead of outpatient, and some of our clients actually do get outpatient, however, they may get outpatient and trauma-focused CBT with that, trauma-focused cognitive behavioral therapy. They may get outpatient and parent management training. They may get outpatient as well as a specialized group. So typically what you see in our provider network is a continuum of services and supports that are specifically designed to meet complex needs. On the video, if you recall, they talked about a clubhouse. The clubhouse is really a supportive environment run by consumers for consumers. So we know that there's a lot of stigma related to mental illness. So the clubhouse provides a place where those who have severe mental illness, a safe, comfortable, supportive environment to do the types of things that maybe we get to do. They take trips, they learn skills, they have computer labs, and the reality is that we live in a society that don't necessarily provides services and supports to those who are the most severe. So if they necessarily went to maybe a local library, you wouldn't have the support or services available. There's an expected level of expertise you have when you go to use a computer at a library. Versus if you go to a clubhouse, you have the services and supports, and you'll have an environment that's welcoming. So this is just a list of services in our network. I had mentioned to you about some key components, and there's a number of them, but I highlight these simply because I think it's important for those who aren't used to working with community mental health to really understand the mindset of the community mental health worker when they're doing their work. For example, we have a number of projects with our partners in child welfare, and so when we are or juvenile justice, so that when we are having discussions about things such as choice, sometimes it gets a little confusing for our partners. For example, let's talk about juvenile justice, because that's probably easiest to understand. You have a child who is adjudicated, found guilty of a crime, and our juvenile justice partners are pretty black and white. You did this crime, you have a court order, go to school, listen to your parents, you get off probation. That's pretty simplistic, but that's what the expectations are. But as a mental health professional, we begin to look at behavior differently than as a juvenile justice professional. So one of the things that's important for us is to understand each other's language, understand our mindset. So when we talk to our partners about families and children have choice, sometimes they're confused about that, only because, for example, juvenile justice, what do you mean they have a choice? The kid broke the law. What do you mean choice? Well, in our system, they have a choice. Even in our system, they're able, even a juvenile justice worker may work very hard to get a child in our system, and if that child says no, that's their choice. We're not chasing folks down and convincing them please or telling you gotta. Just your choice. So consumer choice is a really big part of it. Our consumers have a choice in, and when I say choice, I mean like big word choice. They get to choose. If the therapist isn't working for them, they get to say, this isn't working for me, I want another one. The doctor, the provider, the MCPN. Our whole network of services is designed around this idea of choice. So say you're in wraparound at Southwest Counseling Solutions. You want wraparound, but you don't want it at Southwest anymore. So you can choose to go somewhere else, right? Or say you no longer want wraparound, you want something else. At Southwest, you can choose to do that. Now, the thing that I think people don't understand is that that's not without the understanding that some things that we also need to partner with the families that we serve around clinical need, if that makes sense. So some folks may, just say you have an adolescent that want a new therapist because they're pissed at their therapist because the therapist says something that they didn't like. Well, that's something that clearly needs to be worked out in the therapeutic environment, right? So it's just not like, I don't like you anymore, I'm leaving. It really doesn't look like that. It's a partnership with that consumer and that mental health person to work out. So what are the issues? And sometimes a lot of things can be resolved in communication, whereby a client is unhappy, right? Consider if you're receiving a service somewhere and you're unhappy, sometimes all it takes is someone to actually talk to you, and then it resolves the issue for you. So including the consumer in those discussions becomes very important. So there is clearly choice across the board. Any questions about that? Because sometimes we get it in mental health, and sometimes our partners are like, what do you mean choice? What's this choice thing? And it's no different than the respect you get as an individual and your ability to choose. Just because a person has a mental illness doesn't mean now all of a sudden they're unable to choose. So they get the same level of care and level of service that you get in your daily lives. So that's very important. Person-centered planning. Who's heard this term here before? Person-centered, and that's good to know, because and this language that we're probably starting to see across the board in all systems. I think our partners in developmental disabilities have been very good. They kind of were at the forefront of making sure this is done and done well. But person-centered planning is an expectation of our funding. So person-centered planning is really the idea that an individual has voice, choice, and ownership in the planning process. And there are steps in the person-centered planning process to ensure that. So in terms of philosophically, the idea is truly that as a consumer of service, I get to say who's involved in the planning, and I get to say what works for me and what doesn't work for me. It's really that simple. Now, there may be challenges in that because sometimes you may have somebody with a severe mental illness or a serious emotional disturbance, and their ability to participate in the process may be challenged due to symptomology or something like that. So there's this need for supports. And so the person-centered planning process really does include natural supports and formal supports. It's really who that individual, and if we look at family-centered planning, who that family identifies. So how it works, for example, if the consumer is actually asked initially, who do you want involved in your person-centered plan? And they'll say, well, I want my mom, I want my coach, I want my best friend, and they're all invited to what is the person-centered planning process. So there is actually a time when the mental health professional asks, who do you want involved? So that actually happens. And then there is a separate meeting where all those folks are actually invited to this process, this discussion of goals, services, supports needed for that individual to reach his or her goals. Questions about that? And that's done after assessment. So, you know, the person gets in through the Access Center, there's an assessment, and then they're asked who's on their person-centered plan, who they want on their person-centered planning process, and then there's a separate meeting that's held that is a discussion about goals, services, supports, etc.